Hello, and thank you for taking the time to watch this brief video on clinical trials. I'm Vanessa Hill, the Director of Clinical Research at the Duke Cancer Network, and I'm joined by one of our physicians today, Dr. Melanie Thomas, to talk about clinical trials.
As a medical oncologist with the Duke Cancer Network, I diagnose and treat all sorts of cancer. We want to talk about clinical trials to help you better understand why you might consider a clinical trial.
What is a clinical trial?
Clinical trials are a way for doctors and other healthcare workers to try to improve the care provided to patients, whether it's a new way of doing surgery or a new drug to treat cancer. A clinical trial may study how well a new drug might work and compare the new drug to drugs that are already used. Treatments that your doctor might prescribe today are the result of clinical trials completed in the past.
What are some of the benefits of joining a clinical trial?
Interestingly, it's been shown over many decades of clinical trials that patients who participate in them actually do better and have better outcomes than those who do not. Clinical trials provide new treatment options that may be better than the current standard of care treatment. In addition, participating in clinical trials adds to new medical and scientific knowledge, and it may benefit other patients in the future.
People often ask, who can be in a clinical trial, or is a clinical trial right for me?
Clinical trials involve only those individuals who choose to be in the trial. If you are considering a clinical trial, we encourage you to talk with friends, families, or others you might trust. Ask questions about the trial or other treatment options that you might have. You will likely have many questions to determine if a specific trial is right for you. The most important way to learn about clinical trial options is through asking questions and communicating with your doctor and healthcare team. Asking questions will help answer if you should start with standard care treatment or possibly a clinical trial.
What questions should I ask when considering a clinical trial?
Asking questions about a clinical trial is really important. It may be helpful to prepare for the visit by writing out your questions. Bring a friend or family member and ask them to take notes. It's really important that you understand everything that's being offered to you. Some specific questions to ask include, why is this clinical trial being done? What are the expected benefits of the trial? What are the risks? What are some of the requirements for me to participate in the trial? Will I be paid to participate in the trial? Will some of my expenses, such as extra visits, be paid for, or will those visits be billed to my health insurance? Will expenses be covered if I get sick or injured? Can I change my mind once I'm in a trial, and can I drop out at any time?
The outcome of a clinical trial may be uncertain while the study is ongoing. Is it safe to participate in a clinical trial?
Patients considering a clinical trial are carefully selected to ensure that they are appropriate candidates for the trial. Their overall health is reviewed before and during the trial to assess overall safety. Routine monitoring of patient response to treatment and safety is the most important aspect of any clinical trial.
Who can join a clinical trial?
All clinical trials include what we call eligibility criteria, which are a list of specific requirements for an individual to participate in the trial. The purpose of eligibility criteria is to make sure that all of the patients entering the study have similar health conditions that are being treated and include other important safety assessments. Eligibility criteria allow me, as your doctor, to identify if the trial may be a good fit for you. You, as the patient, can then determine if you would like to join the trial. I encourage you to take time to review options, to become well-informed, and to discuss considerations with loved ones.
Whatever your decision about participating in a clinical trial, we want to thank you for your time and consideration. For more information about clinical trials, please contact your doctor or go to clinicaltrials.gov. Thank you.